Good afternoon, viewers. I am Dr. Cherno Jallow. I'm a Gambian consultant pediatric surgeon. Currently, I am the Deputy Medical Director of the Teaching Hospital. Before that, I was heading the Department of Surgery. And then also, I am the custodian of the Banjul International Surgical Scientific Conference. I am happy to be here at the Arts Media to share information on the forthcoming international conference to be hosted by Banjul International Surgical Scientific Conference, which is slated to take place on the 11th to 12th of this month. That's the Friday and then Saturday coming. And then after that, I will also share some information on Edward Francis Small Teaching Hospital as our only referral, I would say our main referral center in this country, in Gambia. So this is what we're going to, this discussion we're going to have today, to send information out, share with the public. To start, I would want to say, for any country to move forward, the country must have a very strong and vibrant health sector. And then for the health sector to be robust, up to date and current, it must also have a very strong expert, specialist, and then training. And then for the training to be something that probably would is supposedly imbibe current and relevant information and ideas. It must have what we call information sharing and skill sharing gathering. So this is the reason why the surgeons in the Gambia came together to host this annual conference called Banjul International Surgical Scientific Conference. This is the third episode. The first episode was in 2023, then the second 2024, and then this one is taking place on the 11th to 12th April. And then during this gathering, the Gambian surgeons, coupled with surgeons coming from overseas, will come together to share information and skills. During the conference, for this conference, because it's an international conference, surgeons will come from different parts of the world. We expecting surgeons to come from Dakar. In fact, we have one of the most renowned Senegalese surgeon, a urology surgeon, who was a president of the West African College of Surgeons, who also was head of a lot of surgical activities, not only in Senegal, in the world, called by the name Professor Magege, would be here, would have their head of department also. And in addition to that, we will be having surgeons from West African regions, West African College of Surgeons in Nigeria. So we would have currently the chairman of the Faculty of Surgeons of the West African College of Surgeons would come. And then there are also other professors, about 2 of them will join, will be part of this conference. We'll be having people from Canada, people from the UK, from King's College, Evelina, they will all be in this conference. And then they've sent papers too to be shared. So during this activity, we would have these experts sharing research papers in the form of abstracts, and then there will also be very interesting topics to be discussed during this activity, ranging from what we call vesical fistula, we call vibrio-vaginal vesical fistula, we call VVF. That's a hole between where the birth canal is and then the bladder. Usually, the cause of this in this part of the wall is childbirth. When the woman goes into labor and then it's prolonged, usually they will have this. We have a lot of these patients. This type of patient, usually they'll be leaking urine uncontrolled, and they will be smelling urine all over. Nobody will want to have anything to do with them. Some of them will be treated as outcasts, and then some of them would be probably, if nobody would want to have anything to do with them. So this type of conditions are nightmare for these patients, are very distressed problems. So this type of programs, topics will be discussed by experts. Then also other things. Also this year is the medical school of the University of the Gambia. This year will be the 25th year. That's the silver jubilee of the medical school, which was the first faculty of the University of the Gambia. So there'll be a discussion also on that. That's on medical education, postgraduate education, and the way forward. So very interesting topics will be discussed. The papers, over 100 papers will be discussed, and 90% of these papers are all from Gambian surgeons, Gambian experts who did a lot of work in different parts of the surgical specialty. So all these activities are things that will help to uplift surgical education in this country. So it's not only that. Within the conference, there will be skill exchange, because you have these surgeons that are coming, people are coming from different backgrounds. At this juncture, I would want to say there is no country that does the same way as another country. Every country is unique. Because the people in different parts of the world are different. Cultures are different, the way we behave are different. Even health-seeking behaviors are different. Because of that, every country must endeavor to develop your own specialties in a unique manner. So this conference would help in that drive. And then this conference, that would be staged on the 11th and 12th, would be a precursor for the formation of the Gambia College of Physicians and Surgeons, which would help to train specialists from local specialists in the country. We call it homegrown. So when I go to discuss Edward Francis Ward Teaching Hospital, some of these things will be clearer when we say postgraduate training, when we say specialists, especially in the surgical fraternity. So during these 2 days, the surgeons will all come together, as I said, in a very unique way, in a very Gambian way, to discuss surgery in the context of Gambia. So this year, the theme of the conference is the application of AI in surgical practice. You see, the Gambian surgeons don't want to be left behind as far as AI is involved, artificial intelligence is concerned. So we don't want to be left behind. So that's why the theme, and then there will be sessions on this. And then the other sub-theme for this conference also it's on approach of or access to surgical emergency services in the Gambia. So all these two themes are very relevant in these trying moments of our country, because if you look at our mortalities, that we call it death, our morbidity, suffering, by and large, most of it emanates from our surgical our emergency output. And when you talk about emergency, this is a condition or a stage when if nothing is done for the patient, either you lose the patient or you lose the client, or the client will suffer an injury that may be that may affect the quality of life of this patient. So now this conference will discuss that. We'll discuss approach to emergency services in trauma and orthopedics. That's the fractures, bone issues, because we know most of the surgical problems in this country are road traffic accidents. The cause of it, most of it is a road traffic accident. Most of our patients are from that end. So discussing that is very relevant. And then also there will be a discussion on approach to emergency service or access to emergency services in pediatric surgery, that's in children, because we know most of our children come very late to the hospital, and then some of them, if you don't act in a robust manner, you lose them. So we want to discuss that. And then also access to ophthalmology emergencies. So you see, so these are very trying moments in this country. The first conference went smoothly, then the second one, then this is the third one. And then this third one has got to a lot of improvement. The attendance is huge. The preparations it's marvelous. So I'm sure most of the viewers will probably chance on, or if you look for this program, you will get it, and then it is something that will inform you on the surgical capacity of this country. And then, in fact, a paper was published in Lancet not long ago, which categorizes surgery as a human right. That's access to surgical care as part of basic human rights, that every person should be able to access emergency surgical care. So that the theme of this conference is very much relevant to that. And then it was a very good foresight for coming up with this theme. And then when I go to discuss Edward Francis Multi-Gen Hospital, I'm sure most of the people will understand why this conference is taking place, its relevance, and then will know what probably would be the outcome of this conference. And by the way, at the end of this conference, there will be a communique that will come out, as what the surgeons agree, and also very valid recommendation will also come out, which would help the Ministry of Health, also other international bodies in their work in mitigating surgical problems in this country. And so when we say surgery, it also involves obstetric and gynecology care. Not long ago, we had a lot of jittering on maternal mortality, lot of little sort of like protests that our maternal mortalities are high in this country. And then you realize being a person who is directly involved in this and is very close to the happenings, knows that there are a lot of misinformation going around. And then there are also a lot of not only misconception, I would say misunderstanding. Probably part of that problem is lack of communication from the part of the teaching hospital. Probably valid communication is not coming out, and also the public too. Most of the people also are not taking their time to go and get the valid information. So basically, and those are the things. And when I go to discuss Edward Francis Multi-Gen Hospital, some of you will understand why I say there are a lot of misconceptions, misunderstanding on most of the things happening in the teaching hospital. By the way, the maternal mortality in the teaching hospital is taking a downward trend. Though, of course, any woman dying anywhere is not acceptable, even if it is one. We know it's impossible to go to zero because of some very valid reasons, because as human as we are, that in fact is impossible in any part of the world. But every country, every area must be able to reduce it to the bare minimum. And this is what the hospital tries to do. And then I would share some statistics when I come to Edward Francis Small Teaching Hospital. And then you will see that the statistics are going down. And then all that because of a lot of efforts being done by all sectors. Because the problem of maternal mortality is multifactorial. Then you come to gynae problems. That's where IVF comes. That's the woman leaking urine continuously. And then you go to other problems in obstetrics, cervical cancers, and others. Even during this conference, because it's a surgical conference, some of the topics include breast cancer, which is one of the leading cause of death in women. It's in fact has a very big space in this conference. So, and then discussion would be, abstracts are there to discuss the current statistics we have. Also, the current statistics currently, and then also the strategies that have been done to reduce the mortalities and the suffering to the bare minimum. So this means that the best way to go is to have this Banjul International Surgical Scientific Conference, because always it's good at any point in time you look back, you reflect, you see how far you've gone, the strategies you put, if they are working or not working, so that you improve. So this is what this conference will do for us. And then some of the people had seen us going out to look for funds from different places. And then I can tell you a lot of Gambians had given generously to support this International Surgical Scientific Conference, which is non-partisan, non-political, and then very much impartial. Probably the icing that would cap this conference would be an outreach program. So when these experts get into the country, they are not just coming to exchange papers in the form of abstract or skills and other things. And then these experts would also involve in operating Gambians. So we call it outreach program. So all these experts, some would come with some consumables, would come with some equipment that are available here, so that we are able to do complex surgeries. So part of the outreach program, there is outreach, and this outreach now will start from the 7th to the 15th, 4 days before the conference, and 4 days after the conference. So during this outreach, patients will be operated free of charge, and a different type of conditions will be operated. General surgery problems, obstetric problems, gynae problems, free of charge. Patients are already being recruited in the Teaching Hospital. We are anticipating that we would have over hundreds of Gambians to be operated free of charge. If you monetize it, it will go in millions. All as part of this Banjul International Surgical Scientific Conference. Towards that end, I would call on any Gambian who can support this cause. Thank you. Welcome back, viewers. Good afternoon once again. I am Dr. Cherno Jallow. As I said earlier, currently I'm the Deputy Medical Director of the Teaching Hospital, Edward Francis Small Teaching Hospital in Banjul, the Gambia. I was the head of department of surgery, and then I am a consultant pediatric surgeon who operates children up to 18 years. Yes, so earlier we are discussing on the Banjul International Surgical Scientific Conference, and the conference that's gearing up to come on the 11th and 12th of April. So the next thing I would really want to discuss is on Edward Francis Moore Teaching Hospital. There is no system that is perfect. There is no system that is complete. But every system must endeavor or must gear towards achieving excellence or improving. And I would say this is what is happening at the Edward Francis Moore Teaching Hospital. I know people have their beliefs and some people have their experiences from the past. Notwithstanding, I would say a lot of improvement has taken place, a lot of changes have taken place, and I can proudly say the Gambia is lucky to have a teaching hospital like Edward Francis Moore Teaching Hospital that is working very hard to improve the health of this country, to prevent mortalities, deaths, and sufferings that are imminent, and then also to help to improve capacity in this country. But I would first want to say Edward Francis Moore Teaching Hospital is not a new hospital in this country. If you go back in the history lane, we will realize that Edward Francis Moore Teaching Hospital came to being since 1853. That was many years ago, about 2 centuries back, 1853, by the British colonial masters. At that time, it was called Royal Victoria Hospital. So it was Royal Victoria Hospital that was giving services, health services to the people living in the Gambia. So it was like that till in the 1990s, when the hospital, the country had University of the Gambia. It's like 25 years ago, because this year is the silver jubilee of the University of the Gambia. That's the medical school, because it's the first faculty of the University of the Gambia. So the inception of the university, that's the medical school, for the training of homegrown doctors. This is what necessitated the Royal Victoria Hospital to be transformed to a teaching hospital called Royal Victoria Teaching Hospital, to train doctors from the University of the Gambia. In fact, in some jurisdictions, some people may even call it Royal Victoria Teaching Hospital, University of the Gambia, or University, Royal Victoria University Teaching Hospital, the Gambia. So, but it's called Royal Victoria Teaching Hospital. And then the University of the Gambia Medical School is a partner. So students who are taken into the University of the Gambia, so now for their education. So from there, then part of the university is to send them to the medical school, which is a faculty in the university. Then the faculty is also part of Royal Victoria Teaching Hospital. So it's a partnership. For us in the Gambia here, Royal Victoria Teaching Hospital is under health, and then the University of the Gambia is under higher education. Before it was just a Ministry of Education, but now we have a basic education, and then we have higher education. So now the University of the Gambia is under the Ministry of Higher Education. So two ministries, what the two ministries formed what we would call Royal Victoria Teaching Hospital, University of the Gambia. So students are taken by the University of the Gambia for training, and the training is 7 years. So after the 7 years, then they go through more training in the teaching hospital. But part of the training, they spend two years 1 year in the university to do basic sciences. After that, then they go to the teaching hospital to do some courses that are called preclinical courses. After those clinical courses, then they now transit to clinical courses. And then the clinical program is run entirely by the teaching hospital. Of course, you have the medical school office headed by what we call provost, part of the teaching hospital. In fact, it's part of the teaching hospital board. And then you have the hospital, the teaching hospital. So together, they help train doctors. So all these things happen in Royal Victoria Teaching Hospital. So it was like that. Doctors have been trained, and that I would say I was part of the second cohort of the program. Second cohort that we started 2000, and then the first cohort started in 1999. That's why the medical school was the first faculty of the University of the Gambia. So now, then we have the teaching hospital supporting the university to train doctors. So during the clinical division, they rotate within the hospital. The departments in the hospital support them, train them. Because of that, the hospital had to be upgraded to a teaching hospital. And when we say upgrade, it doesn't just mean you just proclaim to say, today we are transforming or we are changing our visit to Royal Victoria Teaching Hospital. No, when we say transformation, it's transformation, both function, infrastructure, and practice or procedures. So that's why that's the time when the lab had to be developed to meet the required standards. The clinical division had to be improved to meet the required standards. And in fact, these things are not done in silo, in isolation. There is an independent body that has been set to monitor all of this, to make sure the minimum standard is acquired so that the people that will be trained in that system are safe, are safe to be able to practice, so that they don't be like free cannon that cause havoc on the public. So that body is called Medical and Dental Council. They are there like a watchdog, monitoring all the training, making sure the teaching hospital has what we call accreditation. They accredit the program to make sure the program has a minimum requirement. So as I'm talking to you, since that time, the Royal Victoria Teaching Hospital has been accredited to train doctors. So now it was like that. And then people graduate, cohorts graduate. When you say cohorts, they are grouped every year. So now I can tell you, we have up to 23, 24, I think up to 25 cohorts. So hundreds of doctors have been trained from these processes. And now, majority of the doctors, especially the first cohorts, most of them now are specialists manning various parts of our health sector. From the former director of health services to our main consultants in different areas of the hospital. So it was good. We had the University of the Gambia. It was good. The hospital, Gambians were able to come together to help to transform the hospital, both in function, infrastructure, and then equipment-wise. So it was not until a few years ago when Royal Victoria Teaching Hospital was transformed to Edward Francis. The name was changed to Edward Francis Small Teaching Hospital. And then that was good, also was a good move. Because if we know the history of Edward Francis Small, we know he was somebody who really struggled to help us attain independence. And for one of the quotation, people like citing was, without representation, there is no taxation. He worked very hard to help us have independence. So given the only teaching hospital, the only referral hospital in this country, that name is fitting. And then it will also motivate the people within to emulate Edward Francis Small. So now the hospital is called Edward Francis Small Teaching Hospital. A lot of Gambians still call the hospital Royal Victoria Teaching Hospital or Royal Victoria Hospital, but officially the name is Royal Edward Francis Small Teaching Hospital. So so what does Edward Francis Small Teaching Hospital do now? Edward Francis Small Teaching Hospital currently is the main referral hospital in this country, in the Gambia. It's a postgraduate institution that is accredited by the regional college to train specialists in surgery, in obstetrics, in pediatrics children, laboratory, family medicine, and other very crucial subspecialty in medicine to train Gambians or people who want to be trained to specialist level, who want to be trained to specialist level. Edward Francis Small does that, that's postgraduate training. Another thing it still, in fact, these have really immensely improved medical education in this country. If postgraduate education is improved, of course, it's a continuum, because then you have more teachers to support the medical school. So meaning that medical education now in the Gambia is more robust, and then it's more fitting, and then the program is very relevant. In addition to what the teaching hospital do, in addition to postgraduate education, undergraduate education, what it does is still giving healthcare to the Gambians. And because it's the main referral hospital, all the cases that are not being able to be managed in the other hospitals are sent to the teaching hospital. So the teaching hospital has done upgrades to enable them to be able to take charge of some of these challenges. Another thing it's doing is research, doing meaningful research that would help to unravel some of the problems in this country, and then also give recommendations that will help solutions to emanate. That's the reason why we are having this Banjul Surgical International Scientific Conference, which is also which is also the reason why BSSC came up. It's because of postgraduate training. Because now there is capacity in the teaching hospital. Because of that capacity, then the surgeons are able to come together, both in obstetrics and in general surgery, with all its subspecialties, to do this international surgical scientific conference. Now, so Edward Francis Small, when somebody mentioned it's probably in the mind of many, it's a hospital that's old, that's irrelevant, that is not meeting up the challenges of a lot of patients. That's a hospital probably that's it's a death trap, and so on and so forth. I would say no. And if anybody wants to detest that, please come and visit the hospital. After that, come to APS Media and then also have a program. But I would say, if anybody dare to, or it's a challenge, you realize that in fact, there are more things that we don't know than we know. Because the problem is there is a thin line between advert and what is information. The teaching hospital should not go to advertise. Maybe in some jurisdiction it's allowed, but in our jurisdiction it's not. We can't go nilly-willy saying we are the best hospital, we have the best doctors, we have this surgeon, we have this, we do, so that is not allowed. But of course you can send information to tell the public the services you run, the things that you are able to do, so that if anybody needs the service, is able to meet those services, is able to come to your end so that you solve the problem. Yeah. So, but I would want to say this. If you ask me, what are the how are the emergencies activities in the teaching hospital taken care of? How is the surgical capacity of the teaching hospital? How is the teaching hospital improving in this current difficult time of our generation? I would say before everybody would know, our emergency services was located at Damban. And a lot of people would remember it was very discomforting, and it really resulted to a lot of suffering to a lot of our patients. But now, what the teaching hospital did, after completing the renovation in Banjul, emergency services has been moved to Banjul. And then you go there, you realize the emergency services, even the infrastructure alone. I wouldn't, if we want to say state of art, maybe a lot of people are using that statement. But I can tell you, it's a place to be. Then the medical and surgical emergencies have moved to Banjul. Our obstetric emergencies has improved. And then they also, Ndemba now is our trauma center, whereby if anybody is involved in road traffic accident or any form of trauma, fall from height, burns is taken to the Ndemba, our trauma center. Then your action is quick and it is able to support. In addition to that, we have our neuro and our orthopedic center at Ndemba. Now, Edward Francis Small Teaching Hospital also has a very robust internal medicine department, pediatrics department. And pediatrics, and there is a pediatric emergency now, which was not there in the past, where any emergency that comes, that is referred to the hospital, that is non-trauma, goes to that emergency unit, which is manned by very qualified intensivists and nurses. Then also we have obstetric care. And the good thing in Edward Francis Small Teaching Hospital now, capacity has improved. I'm sure a lot of people would not know that we have over 20 professors in the teaching hospital that are supporting postgraduate training and then also supporting services in the hospital. And then now we have more consultants than before. Now, any subspecialty you go, for example, in surgery, you have consultants who are able to take up these challenges. Before, you wouldn't have Gambian orthopedic surgeons. Before, you didn't have Gambian neurosurgeons, orthopedic surgeon in the name of Marenas, neurosurgeon in the name of Jabanks. These are all Gambians. And then now you go general surgery, they are there. The JTs, the Roberts. These are all Gambian surgeons. That's why if anybody have time and able to attend the opening, or you watch the opening of the Banjul International Surgical Scientific Conference, you will agree with me. Indeed, the teaching hospital has a capacity to be able to mitigate the surgical challenges in this country. Pediatric surgeons are there, and then other surgeons, because the way surgery is, it's different from other specialties. In surgical fraternity, if any subspecialty is not developed, if any patient comes having problems of that subspecialties, your outcome usually is dire. So that is why a lot of effort is being done to do that. And then when you go to obstetrics gynecology, before probably we had medical officers in obstetric gynecology in the past, but now you have up to 2 consultants, and some are consultants in waiting, because we have up to 10 registrars. Registrars means they are specialists, and then you have the also senior specialists. So imagine in obstetric gynecology, you have up to 10 specialists, you have up to 5 senior specialists, you have professor, and then there is a training ongoing in that department, training people from medical school to juniors, junior residency program, specialists, training people to specialist program, and then also to senior specialist program. All of these activities happen in-house. So imagine if all of these things happen in-house, means that anything that comes shouldn't be a challenge. So meaning that anything that would support to reduce a form of mortality, like maternal mortality, will be trying to support outside, making sure patients that are coming comes in time, and then they are supported before they reach us. But I can tell you, the teaching hospital is not doing all of that. It's also all these capacities that we are building. We also try to support the periphery. For example, the teaching hospital helped Bansang to have an emergency services, to have an ICU, intensive care unit. And then also we send now, in fact, the teaching hospital has taken over the maternal, the obstetric and gynecology services in Brikama and EFSTH, and then we are working hard to cover all these places in a bit to reduce maternal and child mortality to the bare minimum. So these are good moments in the country that I think all of us should take pride in and then celebrate. But unfortunately, it wouldn't, because only a few of us knows all these advances, all these improvements that are taking place in the teaching hospital. Infrastructure is visible. If you go there now, it's up and running. And then before laboratory services, you go there, it's a mere hemoglobin you would have. But now, the teaching hospital has put up strategies to be able to do any investigation in terms of laboratory services that any serious teaching hospital will do. You go and see, we are doing. Of course, nothing is perfect, but it's there, and there are strategies to maintain it. Of course, not all of these things don't go without support. We have a lot of support from different collaborators, from different partners. And then, in fact, in a few weeks' time, our laboratory services would be we hoping to get the accreditation. A team from the West African College of Physicians will visit our laboratory services. They will look at everything from function, infrastructure, equipment, procedures, to see if we have met the standards to be certified to train specialists in our laboratory. And then this work is ongoing, and in a few weeks' time they will come. And we are very optimistic that we will be allowed by the college to train specialists in our laboratory services, like what is happening in other departments. And then we have now family medicine at polyclinic. Before it's called polyclinic, but now family medicine. Now, when you go to family medicine, polyclinic now, you meet doctors around the clock 24/7. And then you are able to do some laboratory services. And then not long ago, I was listening to one of the radios, and then somebody was talking on sports. He said, Gambia is very pathetic in sports. When you have knee injury and then you are taken to our hospital, the only thing they can do is X-ray. You are sent to Dakar so that you do MRI because we don't have it. We don't have what it takes to support. And then I told you we don't advert. Advert is something that is unethical for us. In some jurisdictions, in North America, in some advert, saying who you are, what you do is a norm, but for us, it's not. So, but we would say, if you go to the teaching hospital, there is what we call a mammogram, that is able to diagnose women who have breast cancer, that is able to diagnose women who are developing early breast cancer. And then also part of the laboratory services, and if any tissue is taken, is sent to the lab, we're able to tell you if it's a cancer, if it's not a cancer, we're able to tell you. And we are working very hard to shorten the roundabout, the return time because of some of the challenges. But all of these things are being worked on. So in addition to mammogram, in fact, I was on GRTS last year in October during the breast cancer screening. Then, before me, some panel were talking. They said, in the Gambia, you don't have what it takes to diagnose cancer. They don't have mammogram. They don't have this. So when I come and I say, oh, I think you've done justice to us by saying that, because now I am telling you, we have histopathology services, we have the mammogram. They all clapped, women, and then they said, oh, this is good, it's good you come to us, to the public, you tell us, and then this, you have these things. In addition to that, we have MRI. These are all advanced investigations. There's a CT scan, though the CT scan within this time, we have some hitches. We had 4-slide CT scan, but right now we are installing 128 slides, from 4 slides to 128, which will be able to diagnose some complex cardiac problems. And then, of course, ultrasound is routinely done anywhere, but it's user dependent. Then we have specialists who are doing the ultrasound in our teaching hospital, in Edward Francis Small Teaching Hospital. So, and some of the things that are coming on is we're going into PPP, public-private practice, with some groups whereby we are working on getting MRI and CT scan to Ndemban as our trauma center. So all these things, if you tell anybody a few years ago that we will reach this level, they would say impossible. Even myself, if you tell me that we would reach this stage where we are now, I would have said no. So, but all these things did not happen in silo. It happened as a culmination of partners ranging from the Ministry of Health, of course, Gambia government, anything they don't authorize, anything they don't support, it would have happened. Some support from Goodwill, for example, we have oxygen plants, and then supported by some like UNDP, World Bank is supporting us. All those professors have been taken care of by the World Bank. Of course, the program is rolling. It's rolling down soon, but it's our anticipation that the Gambia government will take over some of the challenges. And then, not only that, you come to oxygen. Before, the teaching hospital was spending over $1.5 million every month on oxygen. But now, as I'm talking to you, the teaching hospital, we have 3 plants. We have 1 oxygen plant in Banjul. We have another 2 plants in Ndemban. We have another plant that is being tested. Of course, the team that helped us was John Hopkins' team and other group. A lot of people worked very hard, including First Ladies Foundation. They supported us on that, and a lot of other groups. So now the whole hospital now, as I'm talking to you, is piped with oxygen, meaning that you don't need to bring cylinders or destroying tiles or using manpower. What you need, if any patient needs oxygen, which is very crucial to keep patients alive, you just need to connect it and then just put it on. So the whole hospital has been piped. And as I'm talking to you today, the leak test has been done. It has passed it. It's good today I'm here bringing out this good news. And then you will hear a lot of good news on it, because some handing overs will be done, and then some programs will be done to showcase some of the good things that has happened pertaining to oxygen. Then, so if all of these things work, of course it's working, it means that we have cut off 1.5 million that has been spent on oxygen to not spending it. So this money will be used on drugs, on consumables, on other strategies in the teaching hospital. And then that's not all. We know if anybody has a kidney problem, if the kidneys are not functioning, if you don't have a dialysis, to survive it's virtually impossible. So most of the Gambians who had money would go to Senegal, and then the ones that don't have the money will just take it as a good fit, and then you lose them. And then the other thing with the dialysis is very expensive. And then I remember in Accra, every session is around 600 Ghana cedis. That is like $6,000. And then you need 3 sessions in the week. So it means every week you need to cough $18,000 to $20,000. So now the teaching hospital, with the help of our partners, the UN system, government, we're able to install what we call state-of-art ultra-filter water treatment plant. And then we have installed 40 machines, new machines that are, I wouldn't want to use state-of-art, but machines that are up to date as far as dialysis machine is concerned. 40 machines. I mean, any Gambian who has any kidney problem and you need dialysis is readily available. Of course, for now, it is going into virtually nothing, free. But so that is why you see most of the services being provided in the teaching hospital are being paid next to nothing. So that's why support is needed in the teaching hospital. And I can tell you, if anybody put their resources in the teaching hospital, they wouldn't regret it, because I would see probably the life you save, maybe yours. And all of us are using the road. If you crash now, you'll be sent to our trauma center. If you have anything before you are flown out, however rich you are, you must be stabilized in our hospital. So you go to our surgical capacities, I can tell you, in our hospitals now, people are using microscopes to do brain tumors, not doing big opening, using microscope, very tactful to remove brain tumors. People now in our hospital, in fact, in 10, 15 years ago, if you say this would happen, some they would say it's impossible. Now, if anybody has hip replacement, we have our elderly, they collapse and then they fracture their hip, and then the head is dead, the head of the bone there is dead. There is what we call hip replacement. Knee replacements are done. In fact, when the first one, when we did it, was covered by BBC. And then you go, people open the chest to do other surgeries. So a lot of things are happening. And when you go to pediatrics, now our referral has gone down to negligible. Because we are able to do children who were born without anus. We are able to create anus for them. Children who have disease like H-Browns, we will have babies who are born with complex congenital problems are all being treated here. Also, even cancer in children, we call it Wilms tumors, cancers are all done here. And then we're able to do chemotherapy and all of that. So all these activities that we are doing, it tells you the teaching hospital is up and running and is really playing its path as the main referral hospital in the country. And then, of course, all these things don't go without challenges. There are challenges. The challenges ranges from capacity, having more hands like nurses, and more honorarium for the gallant nurses, doctors, supporting staffs, orderlies, to motivate them to do more, and then more strategy. So hearing all of this, and that a lot of things are happening within the four corners of the teaching hospital. And then the good thing is, in addition to all this transformation, also another transformation has taken place in the managerial part. That's why we are very happy when we had the Director of Health Services to be deployed to our teaching hospital, who now brought all his the things he learned as a Director of Health Service of the Gambia, all the strategies, all his connections he brought all, and then we're able to improve some of the things, including services. So in summary, I would say There is no better time to be in the Gambia as far as health is concerned than now. The teaching hospital is able to do complex surgeries. The teaching hospital is able to do very bare minimum expected investigations, be it laboratory, be it radiology. And then the capacity in the teaching hospital is up to date and then it's optimal. So now the big task we have for us now is to maintain these achievements we have, this good, very wide stride we've taken. And then because we have this global World Bank program supporting some of the professors we have, this must be maintained, training must be maintained. And then so that's the work we need to do at our end to make sure all these things, good things we doing are maintained, are sustained. But we optimistic in that we are having all the support from the Ministry of Health. In fact, the ministry always jet in and out in our hospital. So that tells you the support we are having from their end. And then another good thing to help to tell us that the program will be sustained is that we have a lot of Gambian specialists who are coming back and who are also being trained locally to take up the challenges. So with this strength, only good things would come. I know still our maternal mortality is unacceptably high, but for example, from 90-something, 70-something now coming down to 53, and then now with this trend, it will go to the bare minimum. But still, the challenges are immense as a low-income country, because the resources we want to have or we should have to be able to sustain these programs would not come readily. So that's why every time they can have more support, because health is everybody's business, it's not only government. And we should be able to support this strike. And before I conclude, I would also want to say, as a pediatric surgeon, when we came, our ward was an eyesore, and we moved to Sanatorio. And then now the ward has been renovated. You go to the ward, if you close your eye, then if your eye is blindfolded and you're taken to the ward, and then it's open there, then you ask, where are you? If they tell you I'm in the Gambia, you will say no. Then the ward has been improved to the best level that any ward in anywhere could be. But this happened by the support of some very good Gambian philanthropists by the name of Cornerstones. They also help us with some solar in our theater. And then we have solar also put up by some businessmen in our maternity theater. So if you see people supporting it, means they have confidence on you. We would continue to call on every Gambian who is able to come forward and support, because health is everybody's business. And then the life you save may